What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, having a great day, staying healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the virus update for Tuesday, October 22nd, 2024. If you're new to my channel, you just clicked on to today's virus update, where I update you on all the viruses that could be a health threat to you and make you sick. One of the big ones we talk about here on my channel is the COVID virus. COVID never went away. You've heard a lot of statements over the past several years stating that it's fine now, it's safe. No, it's not safe. COVID is still a virus that is making people very sick. Some people are going on to develop long COVID. Some people are still being hospitalized. And yes, COVID is still causing deaths. In fact, over the last several weeks, there have been thousands of deaths just in the United States alone. So it is still a big problem. And other viruses are a big problem as well. We're seeing people get sick a lot more frequently. We're seeing a lot of mysterious deaths, way more than we ever saw before the COVID virus ever came around. And guess what? You're not getting very much in the way of answers. You're not hearing the news about what's going on. You're seeing little bits and pieces here and there, but there's no one else that's really trying to bring it all into one daily report. And that's what I do here on my channel. I give you the news, I give you some daily data, we talk about some wastewater, we talk about data from different countries and different states, all trying to just keep you safe and informed of what is going on. So if you're new to my channel, subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course leave your comments down below. We're getting closer to those winter months, which means there's going to be a lot of different viruses at play. Things are going to start getting busier, and I figure we're going to have some busy news days ahead. Already within the past week, things have started to pick up. I noticed I'm starting to tweet more things on X and post more things over on Blue Sky. So let's get into the news, then we'll take a look at some data today. First off, Germany's Disease Control Center reports first case of new Mpox variant, that Clade 1b strain we've been talking about. We haven't heard much about it in a while, but now it's showing up in Germany. So Mpox, it's out there, it's spreading, and we'll have to keep our eyes on this. Moving over to this now, Deebo Samuel, we talked about him yesterday. If you were watching football on Sunday, I did not see this, but obviously at this point, someone who searches a lot will see the news story. And he did 4 snaps on Sunday. Then he was sidelined because he was dealing with an illness. Then he had an oxygen mask on. Then he went back to the locker room, and well, here's the update. He is now hospitalized with pneumonia. Yes, it's not sounding good. It sounds like he is really having a rough go at it, and he started acting up in the middle of the night, Saturday night or early Sunday morning, and then, as you know, they started the game, and then he had that oxygen mask on the side, so yeah. Sunday evening he was hospitalized with the condition, and there is no timetable for his release from the hospital or when he will be available to return to practice or play. So this is something we'll have to keep our eyes on. And we've been hearing a lot of mysterious cases of pneumonia lately. I've been seeing more posts about it. So pneumonia, it's definitely rising. And I just saw a story today, didn't include it here, just saw a story today that pneumonia in kids might be starting to rise in the United States. So yeah, there's some interesting things that are starting to go on with that in not a good way. Now taking a look at an update from Mike Horer, and we're just going to go over just some brief things here. We're not going to read the whole thing, but basically what he's saying is every indication is that the 10th U.S. COVID wave is on the way within 2 weeks. Well, what happens within 2 weeks? Halloween. And we know that COVID transmission dropping, that drop is already slowing. Well, Halloween, as I talked about last weekend, generates a lot of parties. This upcoming weekend is going to be a huge party weekend. There's going to be a lot of those indoor parties, people in costumes, all sorts of different things. People are going to haunted houses. People are going on haunted hay rides. And then, of course, Halloween itself next week. A lot of people will be trick-or-treating, giving out candy, And who knows, you may encounter someone who's coughing up half their lung along the way, passing along a virus such as COVID. So, yeah, I think this is going to be what gets the ball rolling as we head into the colder months and perhaps the very beginning stages of the winter wave. There's already a few areas that are starting to rise. I just saw someone post yesterday that D.C. area is starting to see a reversal to an increase. Yes, Washington, D.C. is starting to see its increase for COVID. And take a look at his forecast model here. And you can see here that when we take a look at this, as we head towards the start of November, things are going to start rising once again. And as we get closer to Thanksgiving, look at this. Yeah, we're not going to be tearing his range. Shows us being not far away by Thanksgiving of that 1 million case per day mark once again. So that's something we have to watch. And you can see here on this chart as well. Things are going to start to rise once again. Will we get as high as the summer wave nationally? I don't know if we will or not, but we are definitely going to see a rise going forward. All right, continuing on. Up in New York State, there is a Republican candidate that is running for office, and that Republican candidate, he is running for New York's 46th Senate District, and his name is Ted Dans, and guess what? He has tested positive for COVID. So yes, once again, another public figure tests positive, and I must say, this is the first one in a while. So, you know, usually when we start to see the COVID positive announcements come from whether it be political figures, celebrities, sports, whoever, you know, the little more known famous people, that's usually a sign that the tide is starting to change. Remember back in the early summer, we started seeing a lot of announcements popping up with COVID again, or a lot of illness announcements. We've been starting to see some illness announcements too. Usually when they increase, that's a sign that, hey, COVID's about to increase as well. It's usually one of the first indicators. All right, this is actually some good news. British Columbia breaks vaccination records, get this, with 82,000 COVID-19 and flu shots in one day. Yes, this is really interesting. And it says here, record numbers of people in British Columbia are being vaccinated against COVID-19 and flu as the province ramps up its immunization campaign for respiratory illness season. That's really impressive. It says that was a record for any single day, about 50,000 shots for flu and 32,000 for COVID-19. You know what that's telling me? That's telling me there's been a lot of people that either have had a rough go of one of these viruses or know someone who did or know someone who died of COVID. So let's face it, how many people can say, and you can leave a comment down below, say they know someone who had COVID and now they are constantly sick, or when they're getting sick with something else, they're having more of a rough go than they did before they ever had COVID. I mean, let's face it, there's a lot of people talking about that on social media. I mean, when I see like a local personality, say maybe a TV meteorologist or someone from TV, like a news anchor, saying, oh, currently down with the virus, boy, do the comment sections blow up with a whole bunch of stories. Oh, our whole family has constantly been sick. Yeah, something just came through, or our child picked up a bug in school. Oh, it's been awful. We've been sick for a week. Yada, yada, yada. I mean, and I think it's starting to lead, at least in Canada here, I think that could be part of the reason why more people are up taking a vaccine. Don't have any numbers for the United States. I was asked about that yesterday. I haven't seen any numbers yet. If anyone knows where I can access those numbers, let me know down below. Maybe I'll put a post out on X asking if someone actually has a link to somewhere where we can have a count of how many people have been vaccinated so far this year. All right, moving on to this now. Young children more likely to be hospitalized for COVID-19 than older kids. And if you read through this, which I did, it is stating that, you know, those up to just 6 months age, really young, haven't been vaccinated yet. And those not vaccinated are having a higher percent of hospitalizations. But it does say teens are most likely to end up in the ICU. And there were 1.1 million people in this report here. So this is big time. I'll make sure this gets over to my website this afternoon, datareport.info. I'm going to be doing a little bit of work on that later on. I actually have a little list here of things I'm going to work on later on. Alrighty, moving on now. And by the way, here is that website, datareport.info. In case you've never seen it, there'll be a link to it down below. There's an archive of studies and a whole bunch of other things. It's kind of like the Wikipedia of viruses. All right, moving on now to taking a look at the National Allergy Map. And we can see there is still some orange and yellow in the south, a lot of green in the north. One of the reasons why there is so much green, like here in Pennsylvania and the northeast, I mean, fall allergies can be a thing, but you know why fall allergies are really not all that bad here right now? It's been so darn dry, and a lot of things are dying. Our grass here is just completely brown. We're in one of our worst droughts in, I want to say, many, many years. Taking a look now at what's going on with air qualities, and I do need to refresh this, and you will see it's sort of a mixed bag of things, and anywhere in the north, and really much of the country, is fair game for bad air qualities, especially if wildfires occur. We've had a few forest fires start up in New Jersey and other parts of the country, I'm sure as well. You can see here, air quality is not the greatest in the northeast. It's not the greatest in the Chicago areas either, even up in Wisconsin, Minnesota, and then you still do have some spotty problems out on the west coast as well, where it's not as widespread as the northeast, but we're seeing the values come up much higher there. Want to learn more about climate and weather? Two ways you can do that. You can go over to my climate data report on X and Blue Sky, or you could follow me over on my climate data report channel, where I don't know if I'll have a video this afternoon, but I think I will have one tomorrow. I'm going to be talking about record warm temperatures for Halloween. Yeah, yep, there's going to be some records. Some places in the northeast that should be maybe in the low 60s, upper 50s, could be at or near 80 degrees on Halloween. Go check out that channel to find out more about that. All right, Philadelphia yesterday had 854 EMS incidents, and if you weren't paying attention this morning, chances are you did not see this. They actually had to fix this. Whoever put this out this morning made the post, and they forgot to put the numbers there. Well, the numbers are there now. It's 854 EMS incidents. Let's do a live look in at Montgomery County, Pennsylvania, and I'm seeing 16 calls. I'm seeing respiratory emergency a couple times. I'm also seeing cardiac emergency a few times. And I'm also seeing stroke up in Green Lane. And yes, we're seeing several different things. Let's see what's going on in Chester County. And yeah, there's a slew of calls here. Multiple respiratory difficulty calls. I'm seeing sick person. I'm seeing stroke listed a few times. I'm also seeing other things going on. So you get the idea. It is busy in both Chester and Montgomery County, Pennsylvania. But what's the COVID situation like across Pennsylvania? Well, it is Tuesday, and we do get an update, and I can say here, it's not necessarily a good update. Remember last week, we had a lot of places that were dropping, and then we had a whole bunch that had no change, but we didn't see it increasing for COVID anywhere. Well, things have changed a little bit. We don't have as many decreasing counties. We also have a lot of counties now that say no change, which means they could be getting ready to flip to increase. We at least do not see anywhere that's having a large increase, but we are seeing in Dauphin County, Pennsylvania, which is where Harrisburg is, that's the capital of my state of Pennsylvania, there is now an increase going on. So things, that drop, it's slowing, and there's even a county now where things are starting to rise. So yeah, we're starting to transition our way over towards that winter surge or winter wave of COVID, and other viruses will soon follow as well. All right, let's take a look at the Canadian viral levels for today, refreshing this to make sure it's up to date. And the viral activity level for COVID is moderate, flu A is low, flu B not detected, and RSV is moderate at this time. All right, let's take a look at some Walgreens COVID positivity levels. Starting off nationally, you do see here, and I showed it yesterday, I will show you again. Take a look real closely. Let's just keep zooming in. You can see, while it's still dropping, that drop is starting to slow down. 16.2% positivity rate. The prior week is 17%. That's a difference of down 0.8%. Total test, 4,551 versus 5,249. And taking a look now at some other places. Let's go to Michigan. We did not look at Michigan yesterday, or at least I don't think we did. Michigan. The COVID positivity rate is 18.1%. Prior week was 15.8%. Difference of 2.3% up. 105 tests versus 152. Illinois. 22.7% COVID positivity rate versus 17.5%. That's a difference of up 5.2%. Total test, 88 versus 114. Oregon is seeing an increase for the positivity rate, and a significant one at that. 30% versus 14.3%. That's a difference of up 15.7%. There's a couple of reasons for this. One, you're not testing that much. This 10 test versus 14, that's a really low number of tests. And two, yeah, you may be starting to see your levels rise once again. Let's stay on the West Coast for a moment. Washington is seeing a positivity rate of 19.4%. That's down by 1.5%. Last week was 21%. Total tests, 72 versus 81. Arkansas is seeing a positivity rate of 19.1%. The prior week was 23%. That's a difference of down 3.8%. Total test, 47 versus 61. And let's just do one more state. This time we'll go into the Northeast. Connecticut. The positivity rate is 14.7%. The prior week was 20.4%. Difference of down 5.7%. Total test, 34 versus 49. So your testing's down, your positivity rate drop. You're not quite at that winter wave just yet, but take a look here. That drop is trying once again to slow off, so we'll have to see what happens there. All right, let's take a look at some wastewater data by region. I wanted to do this today because you can definitely start to get the sense we're entering into the winter wave of viruses. Nationwide, COVID is medium. It's still dropping. That drop is trying to slow off a little bit. Overall, RSV was trending up, then it had a drop. It's still very low at this time. Influenza A, though low, it is starting to show signs that, hey, it is rising at this point. Influenza B, very low, but starting to rise. HMPV is seeing a little bit of a rise. And take a look here. Norovirus is starting to be on the rise as well. It is listed at high at this time. Taking a look now at the Midwest, and wait till you see this. There's that drop for COVID, but let's follow it. Then we came to October. It's stalled. It's hardly even dropping anymore. It may actually start rising pretty soon. RSV is still very low at this time. Influenza A is low. Influenza B is low. HMPV is still low. And look at this. Norovirus. It is seeing a significant increase and is now listed in the high category. Taking a look at the Northeast states. SARS-CoV-2, COVID, is medium at this time. It's dropping. And it's slowing off slightly, but it's not slowing off as much as other places just yet. I think it's about to, though. RSV is still low at this time. Influenza A, it's low, but it is starting to show signs of a rise. Influenza B, no issues with that just yet. HMPV is low. Norovirus is still listed as low. Not seeing a big rise just yet. That is just a wonky movement at the end, so that is not rising yet there. And in the South, we are seeing that COVID, it's continuing to drop, but that drop even there is starting to slow off just a little bit. RSV really is starting to take off now, still listed as low, but if it continues at this rate, it may go up to medium pretty soon. Influenza A shows some signs of rising. Little wonky drop at the end, but overall it is rising. Influenza B is low at this time. HMPV is low. Norovirus is listed as high, and overall it is rising. Finally, we come out to the west coast of the United States, and we do see that COVID at this time is low, and that is, that drop, it's starting to slow off. Not seeing a full rise just yet, but we'll have to keep our eyes on this. That's a little bit of a wonky movement. At the end, RSV very low, but it is starting to rise, as is Influenza A and Influenza B. Both are still pretty low. HMPV is really low, and Norovirus. It's been a multi-movement change at the end. Little wonky, but we'll have to keep an eye on that. It is coming in listed as high at this time, even despite that really big jump. Overall, it was starting to rise. Alrighty, let's take a look at the latest variants of COVID in the United States. KP 3.1.1 is coming in at 57.2%. It does lead the way, and the up-and-coming variant, XEC, is at 10.7%. New Jersey today reports 260 hospitalizations, not seeing any major rise yet, maybe a slowing of the drop, but there is not a rise yet. You can see here, at one point there was just a big drop for some reason back on the 7th of October, and ever since then it's never actually gone back to that level. I don't know if it actually dropped that much, but 69 out of 70 hospitals did report. New York State just only added 366 new cases. That's fantastic news to see that they are that low. And the hospitalizations do continue to drop in New York State. 630 hospitalized, 69 people in the ICU. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. If you enjoyed this update, give it a thumbs up. Let's try for 150 like button hits today to help get this pushed out throughout the algorithm. And of course, if you're new here, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.